Hello, everyone. Thank you for joining us today for our webinar on easing the burden, strategies to tackle burnout, cut costs, and streamline your practice. My name is Maral Sanassian, and I'm the Director of Client Success at DoctorCare, and I will be your host for this session. I will also be joined today by Paulo Gomes, co-founder and co-CEO of DoctorCare. DoctorCare is the largest provider of billing and practice support for over 2,500 physicians across Canada. On average, we have helped doctors recover $25,000 to $30,000 of revenue per year. We also support approximately 25% of all FOs in Ontario. Our solutions and services are designed to help doctors optimize their practice, maximize their revenue, and improve patient care. All attendees today are in listen-only mode. We are recording this webinar, so it will be available to you after the event. If you have any questions during the webinar, please submit them in the Q&A feature, and we will try to answer them at the end of the webinar during the Q&A session. If we are unable to answer your question, one of our team members will follow up with you after the webinar. You are, of course, also welcome to send us any questions you may have to info@doctorcare.ca after this webinar. Recently, significant media attention has focused on physician burnout, overwhelming administrative duties, and increasing operational costs faced by general practitioners in Ontario. These challenges threaten the sustainability of medical practices and impact the well-being of healthcare providers, while also putting the overall effectiveness of our healthcare system at risk. With the ongoing shortage of family doctors, thousands of patients are left without adequate primary care, further straining our healthcare resources. During today's webinar, we will dive into practical strategies to alleviate burnout while optimizing practice efficiency and reducing costs. We will first discuss strategies to reduce practice costs by minimizing staffing and office expense costs. Then, we will discuss opportunities to boost revenue by choosing a suitable payment model and optimizing billing. And lastly, we will investigate tactics to automate administrative tasks and improve patient engagement, followed by a Q&A session. Let's set the stage with some thoughts from Dr. Phan Hoa Meng shared in a recent Toronto Life article. Rising costs, inflation, and the burden of all this new administrative work has made running a family clinic untenable. Let's take a deeper look at the issues our physicians are struggling with. Something that's on everyone's mind in the healthcare sector: increased medical practice costs. Whether you're running a small clinic or a large medical center, we're all seeing expenses rise significantly. Staffing costs are going up. Providing the best care for our patients also means hiring skilled staff. However, as the demand for these professionals grows, so do wages. Then there's the cost of rent. Operating space prices keep climbing each year, whether in a busy city center, suburb, or rural area. And let's not forget about technology. It's a crucial part of modern healthcare, but it doesn't come cheap. From advanced medical equipment to electronic health records and telemedicine platforms, keeping up with the latest tech is essential for compliance and efficiency, but it can also be a financial commitment. Stagnant revenue is another problem, and while the costs have been steadily increasing, compensation rates have not kept pace. Despite efforts to address this issue through various PSA payment updates, the gap between expenses and compensation remains a significant concern for many physicians. With the ministry continuously updating and changing billing codes, increasingly complex billing requirements is another administrative challenge. If you don't keep track of what you are billing and ensure it aligns with the new updates, you can easily get confused and overwhelmed. For example, recently in Ontario, the claim submission deadline was reduced from 6 months to 3 months, which resulted in hundreds of delayed claims and a lot of extra pressure for physicians. More time spent fixing claims leads to inefficiencies in your practice. Patient records, billing information, compliance documents, and insurance forms translate into overwhelming administration that often demands hours of your valuable time daily. Each piece of paper or digital entry demands time and meticulous attention to detail. Maintaining an updated and accurate patient roster is essential for maximizing your billing potential. However, it's a tricky task as there are often discrepancies between your EMR and your ministry data. Moreover, it is often hard to decide which patients need to be rostered or derostered to optimize capitation. Lastly, dealing with a demanding patient community and inefficient processes for patient engagement adds additional strain to your already overwhelming workday. Leveraging technology and introducing automation to your administrative processes is the way of the future and will be critical to allowing you to streamline your practice and improve efficiency. So, let's dive into some practical strategies to help you navigate these challenges, ensuring that your practices not only survive, but thrive in this challenging economic reality. Let's turn it over to Paulo to get us started.
Thanks, Maral. One of the areas at the top of many doctors' minds is the rising costs of operating their practice. Now let's look at some strategies to help reduce operational costs. We're going to look at 4 key areas doctors can explore, including staffing, lease and physical space, clinic management options, as well as phone and fax as a bucket. Let's start with staffing. We recently partnered with ClinicLine. ClinicLine is the leader in offsite medical assistance for physicians in Canada. And with ClinicLine, we survey doctors on how they manage their clinic staffing. And the results reveal doctors' challenges with managing staff and their impacts on patient engagement and clinic efficiency. About 55% of doctors reported at least 1 to 3 unplanned monthly staffing vacancies, with more than 60% saying their staffing costs are going up by as much as 25% per year. So how is that affecting patients? Well, over 60% of doctors reported that their patients have difficulty connecting with their office over the phone, which is a big problem, as I'm sure we all know. So what staffing strategies can you consider to reduce costs and improve clinical operations? Well, we've been seeing a lot of success with practices outsourcing some of their staffing needs to ClinicLine and other outsourced staffing companies. If you think about it, a lot of staffing costs are for administration that can easily be done offsite, especially in areas of the world where you can get some labor arbitrage. A popular offshoring destination is the Philippines, which has many advantages. Most other industries outside of healthcare have figured out that most customer service jobs are actually perfectly well outsourced to places outside of Canada, where there's a cheaper cost of labor, and so you get some labor arbitrage there and a cheaper cost of staffing. Another benefit to using an offering like ClinicLine is that they take care of most of the hiring and training of new staff for you, which relieves doctors of most of the HR oversight and administrative headaches. They also make sure that each agent has a backup, so there's never any sick days, which, as we saw in the last slide, is a big problem in primary care. We have doctors who've saved as much as 30% in staffing overhead by using ClinicLine, run much more organized practices, and never have any problems with staff vacations, unplanned absences, and sick days. Now let's talk about one of the biggest expenses in your practice, your lease. There's obviously a large inventory right now of available medical space in the GTA and across the province, which makes it a good time to consider renegotiating your lease and your terms of your lease. Now, this obviously isn't an option for everyone who's in a lease, but if you have a renegotiation coming up, or if you have an outdated lease, this could be a good option to consider. In terms of renegotiating your lease, if you've been at your location for many years, we understand that it can be tough moving, to consider actually physically moving. However, it's always a good time to check in with the market, and know what your options are. So looking at the average market price and looking for ways to renegotiate for better terms. If you're open to it, of course, you can always move to a new location, and given the abundance of opportunities, this could be another option. The current environment offers great deals on medical spaces, allowing you to find the potential for nice spaces that suit your needs at potentially reduced costs. At Doctor Care, we can always help review your lease and help you decide on the best course of action, whether you're renegotiating your current lease or facilitating a move to a more advantageous location. You should also be looking at how you can optimize your space to increase revenue. So looking at, potential open spaces that are not being used, and subletting extra rooms and unused spaces to other healthcare providers, including allied health providers like physiotherapists, nutritionists, or mental health counselors can help reduce your rent. And perhaps you have a favorite allied health professionals that you're referring to on a regular basis. You could consider approaching them to have them actually consider moving into your office on a part-time basis. A real easy way to reduce costs. Next slide. A real easy way to reduce costs is to examine phone and fax costs. Many doctors are still using traditional telecom services for their phone and fax, like Rogers and Bell, which can add up to a tremendous amount of money. And transitioning to a VoIP service and internet-based fax that integrates into your EMR often reduces monthly rates by up to 75%. And when Well Health Clinics takes over clinics, this is usually the lowest hanging fruit for them and the easiest thing to do to save money. So we'll wrap up this section on reducing operating costs with the final options that we've considered here, which is to allow a professional clinic management firm like Well to take over your clinic. Now, this could be a good option for doctors who are either tired of running their practice and/or struggling with substantially low clinic margins and want the peace of mind that comes with having a professional company implementing best practices and managing the day-to-day staff and operations. Clinic management firm services often include implementing optimization and automation tools to streamline clinic operations. These can include things like online booking, improved phone systems, patient kiosks, and intake forms. Taking over HR responsibilities of your staff and billing and back office expertise. There are many ways to consider. There are many options to consider for reducing your practice's operating expenses, and we're happy to help you here and weigh the benefits and connect you to the right partners, the right potential partners. Over to you, Morale.
Thanks, Paulo. Lots of options for our doctors to consider here. Now, in addition to reducing staffing, overhead, and office expenses, there are several strategies that you can implement in your practice to boost revenue without adding extra work hours. So let's explore these strategies. First off, selecting the right payment model can go a long way in improving practice efficiency and financial stability for family physicians. In this slide, we will compare the Family Health Organization, the FO, and the Family Health Group, the FIG models, to highlight their key differences and advantages. If you are currently in a FIG, you may want to consider switching to the FO model for enhanced benefits. In the FO model, physicians receive capitation payments, which consist of a comprehensive care payment along with a base rate payment. These payments ensure consistent monthly income based on the number of enrolled patients, as well as their age and sex, regardless of the service frequency. For billing, the faux model differentiates between in-basket and out-of-basket services. Physicians receive a 19% premium for in-basket services to rostered patients, while out-of-basket services for both rostered and non-rostered patients are compensated at 100%. The faux model also provides several incentives: an access bonus, all special premiums, and a preventive care bonus. These incentives reward physicians for providing timely and comprehensive care, further enhancing their income potential. On the other hand, the FIG model also provides capitation payments in the form of a comprehensive care payment, however, lacks the base rate payment. For billing, FIG physicians are compensated at 100% for both in-basket and out-of-basket services to rostered and non-rostered patients. While this ensures full compensation for services rendered, it also incentivizes physicians to focus on volume over quality. Now, in terms of incentives, the FIG model is more limited. It does not include an access bonus and offers only some special premium bonuses. The preventive care bonus is available only if the physician's roster exceeds 650 patients. So in summary, while both models support different aspects of family practice, the faux model generally offers more substantial financial benefits and incentives, making it a more advantageous choice for family physicians in Ontario. On average, doctors who switch to a faux model with Doctor Care see an 18% increase in their income. It's no wonder that over half of Ontario's family physicians have already made the switch. To help with this, Doctor Care offers a complimentary transition analysis to determine whether switching to a faux is right for you. Another area full of opportunities for revenue enhancement is your medical billing. However, it is full of complexity and nuance. Every physician stands to benefit from someone who can help optimize their billings, especially when dealing with errors, outside use, rostering, and maximizing bonuses. The documentation provided by the ministry is often cumbersome and difficult to interpret. Many doctors turn to billing software or apps and manage data entry and claim submissions themselves. While these tools can be helpful, they also increase the administrative burden and the likelihood of errors. Handling billing in-house demands significant time and attention from staff, time that could be better spent on patient care or other operational improvements. Plus, managing billing internally can add to your HR load and increase overhead costs. Now, on the flip side, some doctors opt for full billing services, where external personnel manage all billing operations. This approach means no need for additional software on your end. Ideally, the billing company systems should integrate seamlessly with your EMRs, allowing billing specialists to handle everything in the background with minimal involvement from you or your staff. The most obvious benefit of using an expert billing provider versus doing it in-house is a significant increase in revenue. It enhances billing accuracy and efficiency, helps minimize claim rejections, and maximizes your income potential. Plus, it reduces the time you and your staff spend on medical billing tasks, freeing you up to focus on patient care. Whether you decide to hire a full-time billing specialist or outsource your billing, Optimized Billing can help you improve several areas. Bill more regularly. Regular billing is key to maintaining a smooth cash flow and avoiding backlogs. With the ministry now requiring claims to be submitted within 3 months, timely submissions are more crucial than ever. A billing expert can set up regular submission schedules, such as weekly, ensuring claims are processed quickly and any issues are resolved promptly, keeping your revenue steady. Keep track of important updates and dates. Billing specialists maintain a calendar of submission deadlines, roster reviews, and bonus claim periods. Missing the dates can mean lost revenue. For instance, this year, the deadline for submitting your preventive care bonus is June 30th. Therefore, careful tracking is essential to ensuring that you have claimed all eligible services by this date. Correct errors and resubmitting of claims. Errors and rejections is one of the most common discussions we have with our doctors and can cost your practice thousands annually. Billing specialists scrutinize claims for mistakes like incorrect patient information or misused billing codes. They quickly correct and resubmit rejected claims, ensuring no revenue is lost. We will discuss error correction in more detail in our next slides. Maximize bonuses and premiums available. Understanding how to maximize bonuses from the ministry can be tricky, as there are so many. For instance, in Ontario, with the recent changes to preventive care bonuses, many physicians were left puzzled as to how to shift gears moving forward. Or in the case of emergency departments, we see a lot of confusion around how to bill special visit premiums correctly. Billing specialists keep up with changing rules and help you leverage every bonus opportunity. Stay on top of updates from the ministry. The Ministry of Health frequently updates policies and billing requirements. It is important to be aware of these changes so that you can bill your codes efficiently and reduce errors. Billing specialists stay informed through regular consultations of ministry bulletins and other official communications. For example, when the ministry updated telemedicine policies during the COVID-19 pandemic, specialists were quick to inform practices on how to adjust billing practices to these new standards, ensuring continued compliance and profitability. Provide regular billing reviews. Regular reviews are essential for accurate and efficient financial operations. Billing companies in particular often use advanced tools and software to generate monthly reports. These reports offer critical insights into your practice's billing activities and financial health. For instance, they might utilize data analytics to produce a report that highlights patterns of common errors or identifies high outside use patients. By identifying these trends, the billing specialist can advise on corrective actions, such as recommend which high outside use patients need to be derostered and seen on a fee-for-service basis. This strategic use of data not only helps in rectifying ongoing issues, but also in uncovering opportunities to maximize revenue. When choosing a third-party provider to outsource your billing, there are some points for you to consider. Reporting capabilities. Know in advance the types of reporting or tools that you will be provided with. Ensure that they are transparent, easy to understand, and align with your practice style and philosophy. Experience. Make sure that they possess a strong track record in medical billing. Request references from other physicians to confirm their expertise. Comprehensive services. Confirm that they offer a full range of billing services, including claims processing, error correction, roster management, bonus reconciliation, and uninsured services billing support. Reliable support. Ensure the provider offers accessible and responsive help with a dedicated team available to promptly address any billing issues or questions. If you or your staff are overwhelmed with billing or are unsure whether outsourcing your billing is right for you, we can perform a complimentary audit to identify opportunity areas and help you make an informed decision. Now, let's take a closer look at tactical things you can do. First, we'll talk about billing errors and rejections. We talk a lot about billing errors and rejections because it is low-hanging fruit when it comes to recovering revenue. Many physicians think that dealing with their errors and rejections is only a few dollars each month. However, in one case, we ran a complimentary error audit for a client and found that they had over $30,000 worth of outstanding errors that were still actionable. They had many more errors that at that point had become stale dated and lost as well. We were able to recoup the error revenue within a week and have helped keep this doctor's errors on track ever since. Let's go over some of the most common errors we see in medical billing. Generally, the ministry provides you with reports of claims that were refused or rejected and need to be reviewed. These errors are indicated with a code, which you can find descriptions of in the ministry's error codes report. One of the most common errors involves patient demographic information, specifically with regards to their health card. A frequent issue is that the patient's health card information isn't checked before visits. This leads to many rejections that are time-consuming to correct. Another common error we find is related to referring physicians. This happens when the billing number of the referring physician isn't currently eligible for referrals, or if you forgot to include the referral number for a service that requires it. Other errors include using premiums incorrectly, fee code conflicts, or situations where the patient doesn't have insurance and will need a follow-up. These errors can all add up, leading to inefficiencies and more time spent fixing claims. So, how do you manage and reduce these most common errors? For patient demographic errors, it's always better to prevent the error rather than try to correct it later. A best practice is to train your staff who answer the phone always to get updated patient information when booking an appointment. In the case you are using an online booking system for appointment scheduling, it's best to collect health card information at any available touchpoint prior to the appointment. When the patient comes into the office, make sure to check them in, review their health card, and make any necessary adjustments in your system. For errors that relate to referring physicians, double check that you have the correct billing number. Alternatively, you can bill a different service code that doesn't require a referring physician. It is important to learn about the premiums and understand what they require to reduce errors. The ministry usually indicates a reason for the error for fee code conflicts. You'll need to find out the reason related to that code and fix it. A quick reference guide of your most common codes can be handy for reducing these type of mistakes. We have many resources in our library section on our website that you can download for free and use for your billing needs. Fixing billing errors is an integral part of managing your practice. If you need help with error correction, Dr. Care's Billing Care service automatically corrects and resubmits rejected claims on your behalf, saving valuable time and increasing revenue. Now, for those who have joined us that are in a FO, let's discuss an important aspect of the FO model, which is roster management. Effective roster management enhances your revenue. However, many family physicians are not managing their patient roster effectively and are unaware of discrepancies between their EMR and the ministry's data. The number of patients rostered according to the ministry may be less than the number of patients you have rostered according to your EMR. This can occur due to several reasons, including patients accidentally rostering at a walk-in clinic, rostering codes, the Q200, the Q202 being rejected or never submitted, and patients falling off your roster without your knowledge. You may find sometimes a difference of 100 to 150 patients, resulting in $10,000 to $20,000 in unrealized capitation income every year. Furthermore, rostered patients have additional benefits to FO physicians, such as submitting specific billing codes, triggering bonuses, contributing toward your preventive care incentives. Therefore, it really is important to regularly review and identify these active patients in your practice and add them to your roster. So how do you roster patients? To roster a patient, you must submit the Q200 for non-long-term care patients or the Q202 code for long-term care patients. Both physicians can expect to receive approximately $200 per rostered patient per year or $1,200 per long-term care patient per year. Additionally, there are several premium fee codes available exclusively to rostered patients, such as the Q012 After Hours Premium and the Q888 Weekend Access Fee Code, and billing them alongside eligible fee codes can help further maximize your revenue. Now, let's look at some of the specific bonuses and incentives that roster management contributes to, as well as the impact of the new acuity modifier on your capitation payments. Another significant way to optimize your roster revenue is through diabetes management. You could be earning between $20,000 to $30,000 in diabetic management by providing timely and continuous care to the diabetic patients in your roster, and by regularly billing the K030 Diabetic Management Assessment Code, the Q040 Diabetic Management Incentive, and the Insulin Therapy Support Code, the K029. The truth is that most groups are only getting 10% of that amount. For example, we recently helped one doctor recover $10,000 in Q040 billing by performing a review of their roster. By proactively recalling diabetic patients and sending them timely reminders about their upcoming checkups, you can bill the relevant codes at the right time and increase your potential earnings on a standard-sized roster by a significant amount. Another bonus available for physicians in patient enrollment models is the preventive care bonus, awarded for meeting targets in preventive care activities, such as immunizations and cancer screenings. Recently, changes have been made to the preventive care bonus for physicians in the FO and the FIN payment models. With this being the last fiscal year, you can claim all of these bonuses. A portion of the preventive care bonus will be repurposed to create the acuity modifier capitation payment to physicians based on enrolled patient complexity. So what is the acuity payment? It is an additional payment that physicians in the FO and the FIN models will receive based on the acuity of patients enrolled, and this is measured by the Canadian Institute for Health Information Population Grouping Method. So this additional payment offsets the changes to the preventive care bonus and the fee-for-service hard cap. This modifier adjusts payments based on the complexity and severity of diagnoses among rostered patients by considering several complexity factors. Patients with more complex health needs will be assigned a risk score requiring more frequent and intensive care. Practices with a higher proportion of such patients will receive increased capitation to reflect the greater care requirements. With this new update, using the most precise diagnostic codes is more important than ever, as it will help define a patient's complexity and directly influence the acuity payment calculation, with a more complex chronic diagnosis resulting in a higher payment. Another avenue for revenue optimization in a medical practice is billing for uninsured services. But let's face it, many physicians are not the best at handling payments for these services. Many doctors still choose not to bill for certain uninsured medical services due to compassionate considerations or financial aid or through discounted rates. The reality is that each year, more and more services are being delisted from the provincial medical plans. So you should be collecting for these services and you should not feel guilty for it. However, we do know that managing uninsured medical services on your own is extremely time-consuming for you as well as your staff. Most physicians simply do not have the resources and the time. Therefore, finding the right balance is crucial to ensure that you do provide value for your patients while covering the associated costs. We do recommend incorporating a block fee program into your practice to achieve this. Many patients prefer this annual block fee, covering all uninsured services utilized throughout the year at a fixed rate, regardless of the number of services used. Implementing a block fee program allows physicians to recoup some costs associated with delivering uninsured services without imposing excessive financial burden on patients. To implement an annual program or to receive support with the administration of uninsured services billing, many physicians turn to third parties such as our sister company, Doctor Services Group. As they can take care of about 95% of all of the administration of uninsured services, with the ability to integrate with your EMR and customize the solution to your practice and your unique needs. Now, moving on to our final section. Let's turn it back to Paulo to discuss how technology solutions can help automate administrative tasks and improve patient engagement.
Thanks, Morale. We're super excited with the recent innovations in technology in the sector brought on by generative AI. And so we're going to look at a few different solutions here that help reduce administration. We'll start with the patient engagement suite. So online booking, intake forms, automated check-in. These are not brand new tools. These are technologies that have been available for a long time. When implemented properly, these tools reduce staffing costs and help streamline your practice help streamline and improve your practice. But there's really no silver bullet here. These technologies take a lot of time and hard work to implement properly. So there's not like an on switch. They take an investment and they take a commitment from across your staff to really make these work and to get some of those improvements. Online booking allows patients to book an appointment from any device, anytime. Automating patient scheduling through online booking decreases the volume of email and, of course, phone calls, and frees up your staff to focus on other priority tasks. Automated reminders also help reduce no-shows. According to Canada Health Infoway, 90% of all patients actually prefer self-scheduling. So providing patients with another form, which is self-service forms, is another way to streamline processes and reduce administrative load and errors. Automating forms-based processes such as intake forms, insurance forms, doctor's notes, prescription renewals, school forms can significantly reduce the effort required by manual processes and improve data accuracy, limit unnecessary appointment requests, and make actual appointments more about your patient and less about patient work. For the third category, automated check-in tablets are another great way to save costs, reduce labor, as well as keep patient information demographics updated automatically. So when it's time to consider these solutions to automate your patient engagement processes, ensure that any online booking tool, forms, or automated check-in tools meet security requirements and can be customized to your clinic's workflows. And we're happy to review those workflows for you to help you find the right solution. One of the things we're most excited about at Doctor Care and Well Health overall is, as I mentioned, the groundbreaking technologies in artificial intelligence in healthcare. The recent breakthroughs in generative AI have ushered a wave of healthcare innovation, and we truly believe that AI holds the key to transforming healthcare delivery from diagnosis to treatment and ushering in a new era of innovation and efficiency. As we all know, the sheer volume of patient documentation doctors encounter on a daily basis is substantially overwhelming. And I personally believe that AI ambient scribe is one of the biggest innovations that we've seen in a long time. This particular technology listens in the background and documents patient-doctor interactions, allowing healthcare providers to focus more on patient care rather than administrative tasks. So it listens and some like Well AI Voice, which is the Well ambient scribe, can even accurately summarizes a SOAP note from the encounter. So it listens to the encounter and then it automatically summarizes a SOAP note. The statistics shown on the slide are based on a pilot conducted with OMD, and the positive effect of the day-to-day use of ambient scribe is quite significant. Doctors in the pilot saved up to 12 hours a week, they alleviated 85% of their cognitive load. The ambient scribe was accurate 95% of the time in transcribing, and it substantially increased the quality of the patient interactions. Another very exciting area for AI technologies is around a really broad bucket called clinical decision support. And really, clinical decision support refers to a variety of tools and systems designed to enhance healthcare delivery by aiding clinical decision-making. Lots of examples here, but they range from alerts, automatic alerts for drug interactions in your EMR, predefined order sets to streamline care, and documentation that's templated. One area that WELL is heavily focused on is clinical decision support solutions that leverage all of the information, structured and unstructured, in your EMR. We dive deep into your EMRs to find patients at risk for rare or chronic diseases that may be missed, giving practitioners like yourselves the ability to improve the level of care you're offering your patients, as well as optimizing those patient care pathways. This is just a quick snapshot of technologies that are available to help you optimize your workflows, reduce manual administration, give you hours back in your days and weeks, and improve patient care. And again, we can work with you to discuss the best options for you in your practice and identify some ways that your practice would benefit from AI solutions. Over to you, Maral.
Thanks, Paulo. As we close out our session today, we have covered a lot of ground. Let's review some key takeaways we want to leave you with. We work with physicians every day, and burnout is at the top of their minds. While the media is shining a light on the issues doctors are facing, the rising costs of running a clinic, stagnant revenue, and the overwhelming administrative burden is not news to us. If we can leave you with one message today, it's this: you have options. There are several strategies to consider when trying to reduce overhead costs, including outsourcing staffing, renegotiating your leases, space sharing and practice matching, improving your phone and fax setup, or even considering handing off your clinic management to offload the administrative burden and reduce your overhead costs. We also looked at many strategies to help boost revenue, starting with selecting the right payment model and commonly overlooked billing areas. These can go a long way in improving your practice efficiency and financial stability. Having a dedicated full-time billing support specialist take care of your billings can alleviate the extra burden of managing your own billing and maximize your income potential. Leveraging technology to automate manual processes such as bookings, forms, and patient reminders is another way to reduce administrative and alleviate cognitive load for both you and your staff. While there is a lot of hype around AI technologies, we are already seeing the positive impacts in healthcare, and physicians who start embracing tools like ambient scribe and decision support have already experienced significant improvements to the way they practice. Most importantly, we are here to help. To thank you all for attending, we're offering a free practice assessment with one of our expert team members, where we will do a complete audit of your practice workflows to identify challenge areas and opportunities for improving your processes, including all of the areas we covered today. Now, let's move on to some questions from the attendees. As a reminder, your questions and your identity are only seen by our team, and I will read out your questions. However, we'll keep your identities confidential. So we have a question here about the cost of our clinic management services. So the cost is determined based on an assessment of your current operational costs and your needs. So we would be more than happy to conduct a free practice assessment and offer recommendations and provide a custom quote from there. So for providers that are not in the FO, however, are interested in joining one in the future, how can we help with that? So first of all, we can definitely help. We've been managing FO groups for a number of years, and since the PSA agreement came into place, we've helped over 100 of physicians transition into the new model. And so we're still offering a complimentary transition analysis. So we will do an income analysis to show you the value of switching to the faux model. So if you are interested in joining or transitioning into the faux, please do email us after the webinar and we would be happy to help. So we have a question here with regards to roster management and what's the best way to check if the patients that a physician is seeing is rostered or not. So it's actually pretty tough to tell. Historically, EMRs have not been completely accurate at deciphering which of your patients is actually rostered with the ministry. So what happens is physicians tend to have a number of patients that they're managing, that they're seeing, that are actually not rostered to them with the ministry. So Doctor Care does have a method of identifying patients who you are seeing that are not rostered to you, and we would be more than happy to analyze your data and determine the discrepancy for you. Please do reach out. So we have a question here with regards to uninsured services and if we're able to assist with collecting payments. So yes, absolutely. So we do provide full service administration of your uninsured services billing with or without the annual block fee option. It's up to you. So we handle the invoices, we'll handle the payment processing, we can do the follow-up on overdue invoices. So in essence, we'll provide support on educating and informing patients about the fees. And patients are typically provided with a direct phone number to our support team so that we can actually answer any inquiries for them about the uninsured services. A great question here about patient consent and AI tools. So for the ambient scribe tools, doctors are typically recommended to ask for consent right before the consultation. So in essence, explaining that they're using an ambient scribe and that they will be recording the conversation in the background to help with documenting the visit. So as we mentioned in the presentation, based on the pilot that was completed by our partners at Well AI Voice, doctors have really seen that their patients have no problem with the tool listening in the background, as it's really helped with the quality of the interaction. So physicians are able to solely focus on the conversation with the patient and provide consultation without having to capture notes at the same time. Other tools like decision support, the decision to tell your patients is really up to you. Most physicians we find opt not to inform them unless they choose to run further tests. So many tools like Well Health's AI product suite do follow the PHIPAA guidelines. So do rest assured that the criteria for privacy is being met. And then if any of you have any further information that you'd like to collect with regards to the AI tools, because I do see some questions and we're past time, our partners at Well Health do have free demos that they can provide to you. They can walk you through the tooling, show you how it easily integrates into your workflows. You're welcome to email them at info@wellhealth.ai to get started or to speak to one of our practice consultants. So that is the end of our webinar. On behalf of Dr. Care, thank you all for joining us today. If you have any questions or have any feedback on this webinar, please feel free to contact us at any time. Our contact information is listed on the slide. We do hope you have a wonderful day.